Hi, friends. Welcome to another episode of Soaring Through Chaos. Yes, we are in the midst of one of the more chaotic times in the history of our planet, at least in our lifetime. With the pandemic still continuing on, there are major parts of the world that are still in some form of lockdown. And there's a lot of anxiety around health and happiness. There are people who have lost lives. There are also a lot of job losses and disruption to the way we work. Many of us are now working online, but some of the work cannot be done online. And along with this, it has caused a lot of disruption in terms of finger pointing, fault finding, challenging each other. So to me, what gives hope is that these are the times when, if we can accept that we are in the midst of challenges, and if we can grieve the difficulties we are going through, we can grow. It's the area of discomfort that we are in, the unpredictability. If we can accept that, there's a huge opportunity for us to grow. So I keep talking to friends and people I've met in my life who to me are a role model, who to me are like mentors. And I met Dr. Divya Bijur about 2 years ago, actually, almost 2 years ago, during Gokulashtami, one of the festivals in India, the birth of Krishna around that time. And Dr. Divya was in a beautiful temple, or what's called a matha, and she was singing religious chants and bhajans. Amazing, amazing voice. A lot of her music is available online on YouTube, among other channels. What's amazing also is that I'd seen a short documentary on Dr. Divya's life, and we want to hear it from her. So I won't spill the beans. Divya ji, tell us about your life. Tell us a little bit about who you are. And it was, for me, it was a joy to meet you in person along with your mother and to get to know you in person after having seen the documentary. But I'm sure many people have not. So tell us about what life has been like for you.
Hello, Shankarji, and thank you so much for inviting me today. So, about me, I am visually challenged since birth, and my parents are actually both doctors. My mom is an anesthesiologist, and my father is an ophthalmologist. So, of course, it must have been really difficult for them to digest this initially, but since they're into the medical field, I'm sure they accepted that nothing can be done about it. And so they actually accepted my blindness, excuse me. And that I think gave me a lot of strength. And when the family accepts somebody with challenges, I'm sure it's very easy for other people to do that. And so, like my extended family, and I have an elder sister who is a gynecologist. And she too has a very important role in my life, I should say, because we are sisters and we are the best of friends. So I grew up in a very positive attitude, in a very positive atmosphere, I should say. And from the very beginning, nobody stopped me from doing what I wanted to do. So they always told me that you should always think that you can do it. You know, there's nothing that you cannot. And I did my schooling in a regular school. So I did not go to school that is especially like meant for the visually impaired. And there is an institute called the National Association for the Blind here in India that helps people with visual impairment. And in my case, they helped me integrate myself to a regular school. So I used to have their resource teachers who would come home and who would help me with my studies, or they seldom had to counsel my school about how to deal with me, because everyone in my school was really cooperative, and they saw to it that I understood everything. And right from, seeing to it that I would have a scribe or a writer, as you say, for my exams, to seeing to it that I understood everything from like the practicals of science or mathematics. They did their best to see to it that I develop to the best of my potential. And the resource teachers from NAB taught me Braille. I think that's a very important part of somebody who is visually impaired. Whether they are blind since birth or whether they develop it later on, I think Braille is a very important thing that everyone should learn. I feel it can be very tough initially, but it's very important. So that was taught to me, and along with things of daily living like orientation and mobility and cooking, even like different things like ironing or things like that. And so after my 10th grade, generally people land up choosing their careers, or at least the stream roughly in which they want to pursue their careers. And in my case, like everyone in my house in my family was a doctor. My sister was studying to be a doctor. And apart from that, I myself was really interested and curious in the medical field. I was also learning music from a very tender age. I started learning music when I was like 3 or 4. So I really love music too. And so I was in a bit of a dilemma as to what to do, as to how to go about choosing my career. So I attended a career guidance seminar organized by the National Association for the Blind, NAB. And there I met a very senior physiotherapist or a physical therapist. And he instilled that confidence in me that, physiotherapy is a medical field, and it also has a lot to do with touch and to understand the mindset of the patient as well. So you can do it, he said. And I thought, oh, well, if he could do it, of course, I can do it too. So I attended a diploma course organized by NAB itself. That's a physiotherapy diploma in physiotherapy course that lasted for 2 years. And that was specifically taught to the visually impaired, the physiotherapy course. And after that, I wanted to pursue my graduation like my sighted friends do. So I went to the University of East London and the University of Birmingham in the UK because the mainstreaming of visually impaired people, visually impaired students, into regular physiotherapy courses has been happening there since a long time. And I was really curious to know how they mainstream students, how they modify some things so that blind people can operate them, or probably where visually impaired people are given accommodations or allowed to take assistance. And I got really great guidance from there, and I could come here and I pursued my bachelor's in physiotherapy from the Sikkim Manipal University. And that's a course of 4.5 years, and I did it with all my other colleagues are sighted. And it was a very proud moment for all of us when I got to know that I had topped my college in the final year of physiotherapy.
Wow, that's amazing.
In fact, oh, sorry, go on.
So you were like the equivalent of a valedictorian, then you came first in the class, is that right?
Yes, in the final year. And yeah, so that was a great moment for all of us in the family and for all my friends at college and all my other friends too. And then I went on to have, I took 6 months of experience in some other rehab centers around where I stay and in some other physiotherapy clinics. And then I started my own physiotherapy setup in November 2010. And so now it would be 10 years this November. And I also like to do a lot of other things as well. So as you know, I love to listen to music. I love to sing. And of late, I love to explore different music forms. I love to learn songs of different languages. And yeah, I also love to travel. In fact, my father loves traveling a lot. And I'm very fortunate that, you know, I've seen most of India and even abroad, like US, UK, Canada, Switzerland, Australia, New Zealand, Singapore. So I feel I'm really fortunate that they never kind of, you know, kept me at home that, oh, she cannot see. So right from my childhood, I was taken everywhere, be it dramas or cinemas, or even for parties or get-togethers. And so all of their friends accepted me from the very beginning, I should say, and their children became my friends. And so I think I was never made to feel that, oh, she cannot see or she's limited in some way. And so that's how I, you know, started loving this kind of traveling. And I love to learn different languages, to read a lot of books. I read Braille books as well as ebooks, audiobooks. And I love to learn languages, and my profession gives me ample opportunities to do that.
Yeah,
Because
yeah.
I also interact a lot with patients, and I really feel that when you can converse with the patient in their own language, they can be really comfortable and you can actually reach their hearts. So for a diverse country like India, it's very difficult to know all the languages, but I try my best to learn like at least a couple of phrases of the patient's mother tongue.
We have that in
So
common, believe it or not. Sorry for interrupting you there, but I can say hello in 75 languages, and I'm crazy about learning languages, and I'm much older than
really?
you. So we should try
Wow.
that if you don't mind. Indian
Yes.
languages, I can say hello in about, I think, 15.
Wow.
And we have the same mother tongue, coincidentally, Konkani.
Yes,
Konkani tar
Konkani.
yettachi. There is no question
Right.
about that. But I would be curious to hear you speak in other languages, and maybe we can have a dialogue in multiple languages for a couple minutes. What do you say?
Yes, of course. That would be
मराठी तर
fun.
येतच नक्की आपल्याला दोघांना मराठी येतं आपण मुंबईचे हो की नाही
हो, अगदी, अगदी.
और हिंदी तो आनी ही पड़ेगी अपनी राष्ट्रभाषा है तो अपने को हिंदी तो आती है
जी,
बम्बैया भी आती है और खड़ी पाई भी आती है ना
जी, जी हाँ, बिल्कुल.
और आपने बाकी की भाषाएं कहाँ से सीखी आप बाकी की जुबानें कहाँ से आई आपको
So yeah, so Hindi, Marathi, English, Konkani. I also know Gujarati very well.
અચ્છા મને પણ ગુજરાતી બહુ ભાવે બહુ ગમે કે હું વડોદરામાં 3 વર્ષ રહ્યા હતા તો થોડી થોડી ગુજરાતી તો
Okay.
આવડી ગઈ so where did you pick up
Uh-huh.
Gujarati
My college friends are Gujaratis, and we
ah
used to have these batches for practicals, and I was the only non-Gujarati. And they
wow
used to speak amongst each other in Gujarati. એટલે
yeah
હું પણ એમની જોડે વાત કરવા લાગી અને ધીમે ધીમે મને પણ આવડી ગયું.
and Gujarati Hindi and English sorry Gujarati Hindi and Marathi have so much in common
Common, yes, they do.
હું કઈ બાર હું તને બોલીશ કે મારી ગુજરાતી તો બહુ ખટારા છે વ્યાકરણના મર્ડર થશે પણ હું હિન્દી ગુજરાતી મરાઠી મિક્સ કરીને ભેલપુરી ભાષામાં બોલું છું તો
ભેળપુરી અને મિસળ પાવ.
Misal pav, exactly. It's such an amazing combination. First, we have got
Yes.
Hindi English mix, which is English, and then you mix up all the local languages, what the Bombay languages, for lack of a better term,
Yes,
including
right.
Konkani even. Thode Konkani galche madintu. Then it's like
Oi,
Goa misal pav,
oi, गड़बड़ आइसक्रीम.
Gadbad
और
ice
हाथी
cream.
का आइसक्रीम.
That's true. That's true. Maka pav.
का भाव, yeah.
Yeah. I even, this is so amazing. What I have noticed, I had the great fortune of working with some people. By the way, I hope I didn't interrupt your story too much. I'll let you continue.
No, no, not at all. In fact, I was going on and on. You should
No, no, no,
interrupt
no.
me in
This is
between.
exact. I'm here to listen to you. But it's so amazing. I worked with the visually impaired at IIT Bombay and at Tata Institute of Social Sciences informally as a friend or a mentor to a few students. You may know them. Savitri Gupta is doing her PhD at IIT Bombay, and so is what's his name? Kailash Thandel. Both are from IIT Bombay. And Manoj Kumar at TIS and a couple of his colleagues at Tata Institute of Social Sciences. They're
Okay.
all pursuing their PhD in social sciences and particularly focused on social work. So it gave me the first glimpse of what it is like to be in the world of visually impaired because all their other senses are so much stronger. The focus, the concentration, especially among those who have been fairly successful, their visual memory, their 3D memory, they remember things in 3D. They can hear in 3D, in three-dimensional hearing, three-dimensional smelling, three-dimensional kinesthetic intelligence. Since you are in physiotherapy, I
Right.
studied all this much later in life. I was actually not at all 3D, except that I could see things in 3D. But much later in life, when I started working with people with visual impairment, and I started learning kinesthetics through dance movement therapy and
Okay.
music therapy. For the first time, I understood what is 3D music and how, the interference effects, as we call it, that you can actually
Right.
locate the source of sound. So, could you
Oh,
talk about that? How are you? I've been to the National Association of the Blind. There's a office in Worli, right, in
right.
Mumbai. So I've been there a
Yes.
few times, and I was totally amazed how much people with visual impairment can see, how much they can sense through, even they can sense the air around them and know who's
Right.
around and what's going on. They can sense by touch, of course, and hearing and smell. Like Kailash would know when I would go to the bathroom and come back. Kailash, Manoj would, he could just know. And like sometimes I would call from my bathroom and he would say, Sir, आपण bathroom मध्ये काय करत आहात? This is on a phone call. And like, Kailash, how do you know I'm in the bathroom? And you say, the echo pattern, the echoes.
Yes.
He'll say, you're in a small
I
room.
say that to my sister. I tell her, oh, come on, come out now and talk to me. And she's like, oh no,
And,
you
and,
just
and,
want to know.
and people with vision cannot often tell unless they hear the flush. I mean, it's just hilarious and strange. Also, detecting emotional patterns without being able to see the face. Like
Right. Yeah,
Manoj
and I think
knows when I'm
it has to
upset.
be like, yes, it has to be that way, so we have to compensate in some way because
Yeah,
when I listen to people saying, oh, I looked into his eyes and I came to know he's sad, what sad eyes? And I'm like, oh, I'll have to find some way of kind of compensating for not looking into somebody's eyes.
yeah. So tell us about that because this interview or this conversation is about that. That a lot of times people have sympathy for when we see somebody who has, um, from the conventional perspective, you're missing or you have reduced ability to use vision, which for
Right.
most people, vision is like the number one or number two sense. We are so addicted
Correct.
to vision. Everything, television, Instagram is all about pictures, for example. Television is at least 80, more than 50% is pictures and so on. Or like the dramas that you went to, or the sports games that you went to. A lot of
Correct.
visual stimulation, especially for men, but in general for humans, is very common. But what I've noticed is that, for example, my blind friends would say, "Let's go to the beach. It's raining and it's stormy. Let's go to the beach." Like, why do you want to
Yeah.
go to the beach when it's raining and stormy? Because none of the Dolos people will be there. None of the people with vision will be there. I'm like, do you know why? It's because they get scared of the storms. I said, yeah, and they have no idea. We love it. We can feel the wind. And do you have such things too? I mean, do you know what I'm talking about?
Right, right. Yes, of course.
So can you tell us how these compensatory mechanisms work? Because you have a medical background and you have a deeper understanding from first-hand experience on how the other senses take over.
Right. So many times in our field too, we have something called as compensatory strategies where you cannot bring back what the person could do earlier or could feel. So there are many people who lose their sensations, after a stroke, especially, or after some sensory issues. And this I got to know only after I started studying physiotherapy, but I was doing it unknowingly and without knowing that. But say when somebody has a sensory loss of some sort, then the visual aspect becomes really important, because then we have to train them to see the movement that they are doing. And so I think compensation is the way humans cope up with changes. And I think that is the best way to face changes, because change is a law of nature, and accepting change is the best way to live and to deal with it. So, and I was developed in that way because I'm blind since birth. So when my mom went to NAB, she met a very senior visually impaired person there. His name was Chowdhury, Mr. Chowdhury. And he explained to her in a very nice way. He told my mom that she cannot see how high the sky is or how deep the sea is, because he could see earlier. And so there would be many things that she would go through and she will not be able to see them. So wherever possible, try to make her touch things, or try to um, you know um, allow her to listen to all those things. Try to focus her attention to things that she can do and things that she can perceive, rather than things that she cannot. So my mom started, taking me along with her for getting vegetables and fruits and groceries, and she would show me what things are. And then, there's a specific training, like if something falls down and if somebody has to find it, somebody who cannot see, then it's very important to listen to where that thing goes, rather than actually, so earlier what used to happen with me is when something would fall, I would really panic. Oh my God, I just dropped something.
Yeah.
So then I was taught to listen to the fall and to focus on where it is falling, rather than, oh, something is fallen. So I think that's the way many of us have kind of developed. And like you said, feeling the air around, or feeling the aura around somebody, or feeling um, the way somebody carries themselves is really important. And especially in the physical therapy profession, I feel, because in our profession, and that's why I felt that learning language was really important, because languages are ways in which people can express themselves, and hearing is one of the very important ways in which people with vision impairment perceive this world. So I thought that was really important. And so I am also learning Spanish and Greek, apart from some Indian languages like Punjabi, Kannada,
I got to
and the
interrupt you there.
sorry.
I've got to interrupt you there. Is that okay?
Sorry, yes, yes,
¿Cómo
please.
estás? ¿Cómo estás?
Estoy muy bien,
Muy
gracias.
bien, muy bien. Todo bien. It's funny because I got stuck at the beginning of the pandemic in Mexico, Ciudad de Mexico,
Oh,
Cuernavaca, which is a suburb of Mexico. I'm in tears. And so I
oh,
had no choice but to learn Espanol. And you know how
Oh, I
friendly the
forgot.
Spanish people are. You know how friendly they are. So I learned like 5,000 words. And the easy way, as you
Wow.
know, is cognates.
Yes,
Cognates.
cognate.
So between English and Espanol, and also
Yeah.
between Espanol and Portuguese. And Portuguese is
Ah,
related to Konkani.
Konkani. Ah, right.
Konkani, our mother tongue, you and I have the same mother tongue, is very related to Portuguese because the Portuguese were in Goa for 500 years. So
Yeah.
there are many words, simple words like amchigelo is
Right.
probably related to amigos.
Yes, amigos.
Amigos, amgelo, amchigelo, amgelo.
Right.
And there are hundreds of phrases like that. And I found learning
Yes,
Espanol
and
was a feast. I mean, and also learning
yeah,
Portuguese.
and I'm surprised how Spanish is also related so much to Marathi because
Yes, yes.
tu and
Tú,
Marathi comes
tú,
with
yeah.
tu.
Ustedes, yeah, ustedes, like ustad. You know why
Yeah,
it's related to ustad? Because
Ustad.
the Moors, the Arabs ruled a part of Spain for a few hundred years.
Ah,
So there are
okay.
more than a few thousand words in common between
Right.
And Arabic and Espanol, Spanish.
Ah,
And
right.
Arabic made its way in different forms through Persian all the way to Urdu to
Ah,
Hindi.
right. Hindi.
So many
Yes.
words like kitab, hisab, or
Right.
like kismat, uh,
Right.
Khushbu, Ishq,
Yes.
Pyar, Muhabbat, lot of words, thousands of words. So there's that commonality between Hindi, Urdu, especially the Urdu
Yeah.
part of Hindi, Hindustani,
Correct.
all the way to Arabic, all the way to Espanol.
Yes, and in fact, even their music sounds a little
Yeah.
similar, like Spanish and Arabic and
Spanish
Spanish.
Arabic has a lot of common, and of course, Spanish Portuguese has a lot of common, which comes close to
Ah,
Goa music.
right.
Like Na Chahu So Na Chandi, which is originally a Goan song,
Right.
Konkani song, has
Yeah.
its roots in Portuguese.
Right.
So I've actually been to concerts where my close friend Sonia Shersat, who plays the
Uh-huh.
Portuguese fado, she also sings
Oh,
the equivalent songs in Konkani.
okay.
So
That's
between Portuguese
interesting.
and Konkani, there are a lot of transliterated or translated songs too, with
Ah,
a lot
es
of
muy
common
interesante.
lyrics. Yeah, yeah. Even things like ina mina diga, da ina ma diga, makanaka
Yeah,
makanaka. That
Chica Pica Rica.
yeah,
That I
yeah,
got to know that. I was like, oh, this is Spanish.
yeah, exactly. Spanish or Portuguese, and
Was
I had
yeah,
no
even
idea.
Portuguese.
Well, Portuguese and Spanish are very close to each other.
Right.
In
Yes.
fact, Brazil is probably the major nation in South America where they speak Portuguese, and all other
Portuguese.
nations around it, it's Espanol mostly.
Right.
And a very few speak English in Central America. Most of them speak Espanol. But again,
Right.
and Kannada I learned because of my mother was in Karnataka towards the end of her life, which is where I met you
Ah,
about the
right.
time. And our
Correct.
parents, many of them grew up in Karnataka. So ಸ್ವಲ್ಪ
Yeah.
ಸ್ವಲ್ಪ ಕನ್ನಡ ಬರ್ತದೆ, ಎಸ್ಪೆಷಲಿ ಕಾಡು ಕನ್ನಡ ಬರ್ತದೆ.
ಹೌದು.
ನನಗೆ ಕೆಲಸ ಚಲೋ ಮಾಡ್ತೇನೆ, ಗ್ರಾಮರ್ ಬಹು ಕಡಿಮೆ. ಗ್ರಾಮರ್ ಕಷ್ಟ ಆಗ್ತದೆ.
Yeah,
ಕಷ್ಟ
I know
ಆಗುತ್ತೆ.
counting in Kannada, so it's
Yeah,
ಒಂದು
ಒಂದು
ಎರಡು
ಎರಡು
ಮೂರು
ಮೂರು, yeah,
yeah.
all the way to thousands. Yeah, same thing in Tamil, something in Bengali, Tamil,
Right.
Punjabi. किथे जाना है?
Yeah.
It is
Yeah. So
such.
in fact, my father was born and brought up in Punjab.
Oh
So
wow,
yes. And so he really loves Punjab. So even now we go to Amritsar, that is fondly called Ambarsar in Punjabi.
Ambersar. Huh.
Yes. And even today, like my uncle and my aunts and my father, whenever they speak over the phone, they say, Dasso ji, dasso, ki hal chal hai? So I understand a lot of Punjabi and I
Yeah.
try my best to speak with my father. I struggle with the flow of the language, but yeah,
Yeah.
I try a lot to speak that language. And
And speaking of languages, what I found effective was picking up music. And
yes.
Gurbani, which is the music of the
Mm.
Sikhs, the chanting, the kirtans of the Sikhs. Ek
Yeah.
Onkar Satanam Karta Purag, it's beautiful,
Yes.
beautiful. So I picked
Yes.
up quite a few kirtans, and of course there's the music kavalis. There are a few kavalis
Yeah.
in Punjabi also. So
Right.
it's such an amazing thing to find that we have so many common interests. Sorry for
Yes.
again interrupting the flow, but I just
No,
wanted to
no.
point out to the listeners that I'm not visually impaired, but I can be attention deficit in my case. So in other words, I can easily like jump from one topic to another. It's almost like I don't know. It's a mild form of what do you call it? You know, what do they call it? Not It's like a mild form of hypomania, just jumping from one topic to another. It's just a habit since childhood. My mother didn't pay much attention, so I was happy to jump around. But one thing that I can focus is when I'm learning a new script or a new language, because then I cannot jump around. I have to pick up new words, and that just focuses me tremendously. And that's one reason I learn languages, whether it
Right.
is Ki Korbe or He Korbo Joy. In other words, like picking up Bengali, picking up many languages, everything from Thai and Vietnamese to
Oh,
Indonesian, Malaysian,
great.
very related languages. They have so much in common. Mandarin and Cantonese to Japanese and Korean. Just a few words in each language, not a whole lot. Just a few words to say, how are you? ¿Cómo estás? Kind of words.
Yes.
So tell me about your journey. Sorry for interrupting you again, but I would love to hear more.
Okay. So, yeah, and so I started my clinic in 2010, and then I started having patients. So, what happens is it's a little different when you're treating patients around, and like, your professors are around or some friends are around. It has its pros and cons. Like, if you have your professors around, it's like a safe thing to do. And if you have your friends around, many times patients, like, it's human tendency. I'm not saying that everyone does that or shouldn't be doing that, like there's no right or wrong, but people tend to compare. Oh, she cannot see, and how will she treat me? So it used to be a lot of like proving myself, or that kind of a thing. And of course, every hospital has its own protocols, and so we have to go according to that. But when I started my own clinic, like, I can't say I won't like to work in a hospital, but it's just that you really have to be alert about what somebody keeps or places where. Because when you cannot see things, I've heard many of my friends say that, oh, my parents or people at home sometimes, they keep things here and there, and then I can't find them. So the same thing would happen in such hospitals. But then, of course, many people, like, first I would be really embarrassed, like, oh, how do I ask this person, where have you kept this? But then I, just found out that many people who could see would also ask each other, just in order to save time, and, oh, where is this so and so machine or so and so equipment? And so I shed off that inhibitions of not asking for just information, or even for some assistance. And that really gave me a good amount of confidence. So when I started my own clinic, I developed that skill. So when you would evaluate a patient, there's something called as history taking that's really important for any medical professional. And that's the best time I thought I could utilize in giving the patient the confidence that I can treat that patient. So I started doing that, and it's the Almighty's grace that, after I've started out my own clinic, nobody has, come and asked me, oh, how will you treat me? They just kind of develop that trust, I can say, that confidence that, oh, yes, she will treat me. And that has really kept me going, that has kept me motivated to work harder and harder for my patients and to learn new things. So after my graduation, like any field, I would say, is vast as an ocean. May it be a language or any kind of science or anything. And so I always try my best to keep my skills up to date by attending courses and hands-on seminars and workshops so that I can treat my patients better. And I am also associated with Hadley Institute for the Blind and Visually Impaired, that's based in Chicago, Illinois. And they are doing wonderful work, very dynamic work for the visually impaired. In particular, they also have courses for special educators and for family members of people who are vision impaired. So I have been doing their courses. They have distance learning courses that are totally free of charge for people who are visually impaired and for their families. And that's how I started learning Spanish from there, because I took a course in conversational Spanish from there, excuse me. And that's how my Spanish journey began. And they have many courses like independent living and safety in the homes, or even self-defense. And now they've brought out a very nice change. So now they have something called as, they have short videos of the courses that they want to conduct. And then we are to see those videos and they are very informative videos. So you can have a lot of information in a short period of time. So yeah, and I also conducted like free physiotherapy consultation camps. I conducted them for the last 5 years, but this time we did not want a lot of crowding in the clinic, so this time I couldn't conduct it. But for the last 5 years, I was conducting these camps, and I would conclude them on 15th August. That happens to be India's Independence Day. And the theme of the camp used to be freedom from pain this Independence Day. So, and that was a wonderful thing, because I would have patients coming to physiotherapy, with at an earlier stage of their problem. Because generally what happens is, of course, now there's a lot of awareness about physical therapy, about when someone should go to a physio. But still, there are some people who feel that, oh, okay, my pain is okay, I'll go once it, kind of flares up. But once the pain flares up, it's really difficult to kind of bring it down. As in, it takes a longer time, or, rather, it can kind of weaken the person. And so the rehabilitation takes longer overall. So I just noticed that because of these camps, I could get patients early on, and they would report their problems to me early. And so it was great to treat them, and it was a great way of, I think, spreading more awareness about what physiotherapy is and how it helps to rehabilitate people and to let them, to help them to get going again. So that was something. And
Yeah. In fact, I can tell you a little bit about my brush with physiotherapy. When I was
sure.
38 years old, like what you said, I had all these little things that were popping up, but I waited and waited and waited until it became unbearable. So I had a
Oh,
combination at that time of not only plantar fasciitis, which is
yeah.
the pinpricking pain in the feet, unbearable pain. I could not even walk for more than an hour, or even, yeah, just plain walk for more than an hour. Or
Right.
along with that, I had tendonitis, so especially the hands. It did not become worse than that, but it was painful enough. And then,
Oh,
as both kind of kicked in at the same time, plantar fasciitis and tendonitis, then I would start getting aches and pains all over my body, especially the joints, the shoulder, the neck, and all that. And I was just 38 years old. It was crazy making. So
yeah.
the good news was that I did have good physiotherapists and people, even chiropractors, and they helped me to rebuild my confidence in myself. And funnily enough, the reason why all this had started was partly because of bad posture, which as well as
Right.
not like right now I'm sitting in a very odd position, and if I do that for more than an hour, it will result in like repetitive motion kind of pain. And I'm very well aware of that. So I did that just to break the monotony of interviewing from a chair. I said, okay, I'll sit on the bed, but I just won't do it for more than an hour because it will
Right.
lead to a lot of unnecessary pain and referred pain and all that. But what is interesting was the role of the mind, because it wasn't just the physical pain. A lot of it was driven by almost an obsessive compulsive mind to win. The determination to win was so strong. I would be up 18 hours a day working on something or the other. Not enough physical rest, not enough rest for the mind. And there was a neurologist who said your pain is as mental or emotional as it is physical. Have you experienced that in your career, that people drive themselves like crazy and then end up ruining their body?
Yes, a lot. So, in fact, it's like a two-way relationship. So, if your body starts hurting you, you are afraid of moving many times. So, and then it gets kind of a mindset that, oh, if I move, it will pain me. Like, for instance, if people have back pain, and if they've experienced that, oh, I lifted up a lot of shopping the other day and now I'm having pain. So, I shouldn't be lifting up heavy things. And that kind of builds up in their mind. So every time they lift up heavy things, they start having pain. And so now many physical therapists train themselves for something called as cognitive behavioral therapy.
Yeah.
So that, yeah, so that they can also train the mind along with the body. And sometimes, yes, so because the body kind of pains, like we were talking earlier about the compensatory strategies. And like you said, you had tendinitis. Like tendinitis is generally very specific to a tendon, but the compensations that the body does to, protect that area from pain, that kind of lands us up in more trouble many times. And of course, tendinitis or the trouble, actual trouble is always there. And that again affects the mind. So pain is, said to play a lot with the mind and vice versa. So if the pain kind of sits in the brain, then the mind would stop you from doing things you would want to do or you used to do earlier. And so it's very important, like we as physios also have to motivate people even emotionally and when we are training them physically. So that confidence that the mind gives to the body is also, it plays a key role along with the physical strength. So the physical strength would, convince your mind that, oh, I can do this. But of course, the mind has to, supplement it by saying, oh, yes, I can do it. And then many times I tell my patients that your body would listen to your mind. Sometimes it wouldn't even listen to me. So I always tell them that you should trust yourself first, and then of course if you trust me and believe in what I tell you, then of course you'll be fine. So mind has a lot to do, and I love psychology a lot in that respect, because we as physios also talk a lot to the patients, and we also try to know what's going on in their minds, and in the process we many times we discover lots of conflicts or things. Some patients, of course, they just kind of confess that, oh, I have an anxiety disorder, or I have a depressive disorder. But in some of them who are not clinically that way too, or they are not diagnosed, um, their pains can be related to lots of stresses in their lives or lots of stressors. And so it's very important to, like, I'm of course not a trained counselor, but it's very important to tell them many times that, everything that happens to us, or everything, like, somebody else's behavior is not in our hands. So only our behavior is in our hands, and we can only do our best. And, sometimes we have to leave the rest. So because our muscles very much respond to our emotional state. So if we are stressed out, we kind of, sit in the slouched posture, and we'll end up tightening our muscles. And it's also the other way around. So if we have a good posture, if we are sitting straight, and it gives us great confidence in ourselves. So posture can also help us emotionally, and our emotional states can govern our posture. So it's like two sides of a coin, if you go to see it that way.
Yeah, yeah. In fact, one of the things that has, as you can imagine, when I went through this bout of extreme physical pain, I got interested in understanding the mind-body connection deeper. And Dr. Avi Heskowitz, who was a neurologist, cardiologist at University of California, San Francisco, guided me to go deeper into that using meditation practices, particularly breath awareness, a mindfulness of the breath, and later
Mm.
mindfulness of the body, also described in Sanskrit as vipassana, or understanding the physicality of the body and how the mind arises from the body. Something similar would be any form of yoga nidra or asana pranayama, again, rhythmic breathing as it's called in English,
Yeah.
understanding the connection between the body mind. Have you gone into that area? Have you studied any of these things and its relevance to the wellness of the body and the mind?
Yes, I have learned yoga, and I have done like a certified course that happens for 3 months.
Hmm.
And even in physiotherapy, we are trained to give some relaxation techniques to patients. And one of them is the Jacobson's technique. And then there are contract relax techniques. So there are various techniques to basically make the patient aware of the body, to make them aware of their strained or their stressed out posture first, and then initiating them into that kind of a relaxed posture. And diaphragmatic breathing and things like that are also really important. And of course, in yoga, I did a lot of breathing exercises and the asanas, and like the shavasana. That's especially, that helps one to go into a meditative state by kind of gradually reducing the awareness of the body. So that really helped me to considerably reduce my stress. And I felt that music helped me a lot to build that mindfulness, to kind of empty my mind of thoughts, and at the same time doing something very divine, very constructive, something I would just lose myself into. So that helped me a lot, and it still helps me a lot to de-stress myself, or to get out of anything that confronts me.
In fact, speaking of music, I'm a big fan of music therapy. And one of the classic books on that was by a musicologist or a musician turned psychiatrist in Canada. I don't remember his name. It's called This Is Your Brain on Music. It goes deep
Oh,
into how music affects not only the lyrics and the poetry, which the prefrontal cortex and the limbic brain interprets, but then you go deeper into the feelings, which the limbic part of the brain and the heart and the cadence and the tempo and all that. It's just amazing, and how the body, mind, everything comes together, because we cannot just sit quiet without moving when we
yeah,
listen to music. So again,
yeah.
that brings about the rhythm, and that slowly moves into movement. Have you gone into that deeper, because you are a musician and you're a physical physiotherapist? So you must have explored the connection between those two.
Not a lot academically, to be honest, But I feel music really breaks the barriers of culture and language. And I started kind of noticing that more when I started learning foreign languages. So, of course, I was learning English from my school days. And so, Western, like English music, was not a problem to comprehend. But now, when I learn Spanish and Greek, and when I listen to the music, many times I can pick up a few words, but the music itself many times kind of conveys me the context, like whether the singer is trying to be romantic or sad or angry, or that kind of an emotion is conveyed. So many times, like, I don't understand the entire song, but yeah, it really gives me great insights into what the singer actually wants to convey. And that way I think music is like, it, of course, it helps us to heal, but it also gives us the power to express, I feel, many times. And that expression in music I learned when I was like quite later on, after I started learning music from Geeta Yanimidi Pachi, who is also Amchigali. So she
Right.
taught, yes, and since then I started realizing that the power of music, the expression that it can, the way it can help us express ourselves. Um, and of course, when it's combined with the lyrics and music and um, the expression, then it's the ultimate way, I think, to enjoy music. And of course, even the movement parts. So even in physiotherapy, people who have coordination difficulties are helped to exercise to a rhythm so that they can establish their coordination eventually. And a lot of research is going on now on Parkinson's disease.
Yes.
So people,
Yes.
yes, so they are taught um, to dance to a particular music so that they can, gradually, like, at least the symptoms can reduce to some extent. So,
Yeah, in fact, Stanford Hospital has a program now for Parkinson's disease, which includes music as well as movement, rhythmic dances. And I think the results have been very encouraging. I don't know how
yes.
much clinical studies they've done, but for sure, there's a lot of good data that it actually helps to bring back that hand-eye coordination as well as the yeah, what they're trying to do and what they're doing, and bringing back the sense of cadence in their life.
Yes.
That reminds me of you were mentioning about emotions and feelings, the navarasas, and understanding the ragas in Sanskrit or in Hindustani Classical, very much
Right.
relate to the relationship between mood and the depiction of mood and even temperament and the seasons. Like, you have the Basant
Yeah.
Raga and you have the
Yeah.
ragas
The
that relate.
Basant is a raga of the spring. And
Yeah,
yeah.
yeah. And interestingly, the person who taught me a little bit of music was when I was in Chitrapura, when my mother was passing. It was Narendra
Okay.
Mam or Narendra Padukone, one of
Okay.
the very senior people. And he took it upon himself. He saw that I was hurting, my mom was in the
Right.
last stage of her life. And he made sure that I would practice with him for an hour every day. So, what a
Oh,
blessing. So it was
yes.
really a
Indeed.
blessing to be able to learn basics of music. As soon as my mom passed away, I stopped. And he was like, "You're not a good student. You stopped." So I told him someday I'll resume again. So, yeah. So, again, one other question I have.
Hmm.
You're one of the few who actually went to mainstream schools. Thanks to the National Association for the Blind, as well as many other resources, you were able to continue schooling at regular schools from what you've mentioned, both at the elementary, middle school, high school, as well as at the what do you call undergraduate and even the postgraduate or medical school, physiotherapy school. What were the benefits of being in a mainstream school versus, say, for example, the schools that are created for the visually handicapped? In your case, did you find it actually better in some ways?
I think both have their pros and cons. And I did not realize the advantages of this when I was actually at school, because it would be really hard to communicate in the initial years, of course, when I was a toddler, because everybody else is as small as I am. So they would actually be really confused as to how to communicate with me. And I would be confused as to, why is this person not talking to me? And when you're small, you don't have that concept of ice breaking and, going to someone and talking to them. So initially, during my pre-primary or say primary years, I had a really hard time making friends. But then later on, like when I was like 11 or 12, it was much easier, because I would be able to express myself, and people around me, I think probably by that time they were used to me, and they knew that, oh, this girl cannot see, but yet she's studying just like all of us. And so probably they too chose to communicate with me, and then I made very good friends at school. So I think that ways it's advantages, because you come to know what people who can see want from people around them. So uh, I was taught how to look at someone and talk, because people who cannot see since birth, I feel, have to be taught that, because they are not able to notice that. Of course, the sound aspect is always there, but when you're young, you don't tend to notice things a lot. So you would think, okay, I'm able to hear this person, so it shouldn't matter, whether I'm facing that person or whether I'm looking at that person. So that those things are, I thought, I got to learn a lot. Plus things like very subtle things, like how someone would sit in a class, how someone would present themselves, or things like that. I got to learn a lot, because when we grew up, my friends were they were really open about telling me a few things. Like I wouldn't notice, like, and of course that time I was not a physiotherapist, so I wouldn't notice that, I would just go like this or stoop, or when somebody was talking, I would look down or something like that. So they started telling me all those things, and I was like, oh wow, I'm getting to learn these things. And of course, the greatest advantage was that I could stay home. I could stay with my sister, with my parents. And I think that resulted in a great bonding between all of us. And I think that kindled a lot of understanding between me and my sister. And she knew what I wanted, I knew what she wanted. And we would play, I would play with her friends, and we would make new friends. So I would play all the games that we would play in childhood. So everything like hide and seek and a dog and the bone and everything. So
Wow.
it was fun that ways. So when I came out of school, I felt like, oh, I did not know the games that blind people actually played, like the cricket, or I got to know all that a little later. um, but yeah, but I just thought I was very fortunate that I could know all these things. And at the same time, I feel people who go to schools that are meant for visually impaired, eventually they are mainstreamed into a regular school, I think from their 7th grade. I think so. Yeah.
Yeah,
So when
yeah.
we're at
At the
school,
higher
yeah,
levels, there are not too many separate schools. Definitely
yeah,
not at the beyond college, undergrad. I think there really are no separate schools, isn't it? At the
yes,
master's,
yes, that's
PhD
true.
level, there's no choice
Yeah,
really.
it's all the, yeah, mainstream. So I'm not sure how difficult it is to mainstream ourselves, but I thought it was a very seamless process for me, because I could mainstream myself later on, even in a physiotherapy college. because my professors were initially not sure about how to teach me, but the guidance that I had got from the universities in the UK was very valuable that ways, because I had the confidence that yes, I can learn this. So that was, I think, integrating myself at school was very advantageous. Otherwise, but I feel that people who go to schools that are specifically for the vision impaired are very independent since a very young age, because they don't have their parents around to protect them, that, oh, don't go here or don't go there, or that comes naturally to parents when children are young. And I don't think that has a lot to do with vision impairment. But yes, if a child is visually impaired, then parents do tend to protect them a little more. But
Yeah.
if you're in a blind school where everybody else is vision impaired, then nobody cares. So you just have to fetch for yourself. You have to learn to go places yourself. You have to learn to do everything yourself. So I think that makes them very independent since a very young age. And I think that's a great advantage. Of course, everybody has to be independent eventually. So once you're thrown into the sea, you better learn to swim.
Yeah.
But yeah, but yeah, I think that uh, transit, I won't say transition, but yeah, that getting into that kind of an independence is much more seamless for people who go to blind schools than for people who go to regular schools.
Yeah.
That's what
Yeah.
I feel.
One of the experiences, I had some incredible experiences working with the five or so blind students. A couple
Mhm.
of them were when I was helping them. A few of them the boys wanted to learn swimming and dancing. And
Okay.
I was like, okay, now how do I teach them swimming when I cannot say, I cannot just show them, you know what I mean?
Right.
So, but it was
Right.
easier with the boys because I would actually hold their hands and show them
Yeah.
how I move my arms. And they were science students. Both of them had
Correct.
really good understanding of physics and so on. So I'm like, okay, you pull the water this way, you do this. And you won't believe it. In 2, 3 days, they were at least able to swim underwater. And the
Wow.
concentration was amazing. These were not young people, they were in their 30s. But at the
Oh,
IIT swimming pool, I had like four people swimming very easily underwater. The difficulty, of course, is then pulling your head out of the water and breathing.
right.
But
Yes.
all I had to do was show them the posture, holding hands, and making the
Yeah.
arms move and the legs move. So, and helping them hold my hands when I was moving,
Right.
hold my feet and actually see the motion, see as in,
Emotion.
kinesthetically feel the motion. They were superb in picking it up. Same thing with dance. Again, I was like, now how do I show them how to dance? Again, I showed them to one of the interesting things about dance therapy is you allow your proprioception and interoception take over. You
Yes.
know these technical terms. In other words, your body knows where your arms are and your feet are, your legs are, without you actually looking at it,
Right.
right? At least one of them, I don't remember which one, interoception or proprioception, is about knowing our body in space and where it is and what's happening, and then the visceral sensations that come from different body parts. You know what's
Right.
happening. You have an kind of an understanding of what's happening inside the body as well. So I was like, okay, you want to learn to dance? Allow the body to move in whatever way it gives you joy when you hear this music. Let your body
That's
move.
awesome.
And then I would actually show them, okay, this is what conventional dance is. When you're listening to Jhingat, this is what they do. Or when they're listening to, like Sambalpuri music, or they're listening to Garba, this is what they do
Yeah.
conventionally.
Correct.
But they would invent new steps. Because
Yeah.
once I told them the idea that you let your body move in a way that gives you joy. Does that make sense to you? Do you see how
Yeah.
in
Yes,
physiotherapy,
it's
I'm sure you
wonderful. And
learn.
Yeah, it's wonderful. And I think you are an awesome teacher because uh, many teachers, you know, kind of try to think themselves, they try to put themselves in their students' place. And many teachers do that, but I think there are very few teachers who would actually, like you know, try to close your eyes and just imagine that, oh, how do I teach them this? Or so when we were just talking, like informally, we were talking about like people showing pity or, you know, sympathy to people who cannot see. So um, that's, of course, the most unwelcome thing. And I'm sure all people with challenges would agree with me.
Yeah,
But
yeah.
it's so nice to see that people understand and try to understand that, you know, how we can, you know, try to impart new skills and things that people have never done before.
So I'll
So
give you
I'm sure
another
your students
example.
must have enjoyed
So,
your
so they taught me
teaching.
something that I'll never forget. Um, particularly this guy, Kailash Tandale, he told me,
Uh-huh.
"Sir, you want to learn how our world looks like? Aankhon mein patti bando." So I took a dupatta and I actually closed my eyes and I said, "You know what? Kailash and Manoj and Savitri and Sonali and all can't see the whole day. So why not I try 30 minutes?" 30 minutes felt like, believe it or not, 30 minutes felt like 30 hours to me with my eyes blindfolded. But in those 30 minutes, I was able to feel around the room. I also realized how little attention I pay with my eyes open. So I would say, but I cannot find the door. Where is the door? And he would say, he's very funny. Kailash would say, "Dore phutlega tumse." So, so I would take out the blindfold and I was like, oh, so the door is here. And you would say, even with your eyes closed, you can feel the warmth of the sun. You can feel the direction of the wind. When you go from one room to another, the wind or the air around you changes directions. So you can
Right.
feel where the air is changing or the pressure changes or the echo changes. And more and more, I've come to the point of where I can actually close my eyes and boil a pot of water, without fear. But it took,
Right.
honestly, it took a lot of courage. It took a lot
Yes,
of
and you
courage.
did it. Wow, because not many people, you know, try and do it. Like they think that they understand people who are visually impaired, but of course, it takes a lot of courage to actually do this and kind of throw yourself into it, at
But
least
yeah,
for some time.
and I had all the time in the world because I was not under any time pressure. I was not doing any other work. So I was just 24 by 7 with these guys for probably like 20 or 30 days. Cumulatively over the last 3 years, I spent more than a month with people with visual impairment. We went to a mall. I'll give you another example which just shook me up. So we went with all of us. We went together
Uh-huh.
to a mall in Thane. There's a big mall there. If you
Uh-huh.
remember, don't remember its name, but it's one of the bigger malls in Thane. And so we went to buy clothes. So I
Mhm.
was very curious, how would they select clothes? So Sonali would particularly ask, "Sir, my like she loves earrings and she's also a designer, believe it or not. So she
Mhm.
can compare and contrast designs like patterns in clothes and her earrings and her, top and bottom and hairstyle and all that." And I was like,
Mhm.
how can this girl see things? Then Kailash and Sonali explained it to me. They said, "Look, how do you know what pattern matching is?" I said, "I don't know. I can see it." I said, "But still, how do you know that one pattern works with the other?" And then I said, "Oh, somebody told me that if you're wearing a top that is, with like a solid color, then maybe it's a good idea to have stripes on your
Right.
bottom and vice versa." So like the contrast or the similarities. See, they said we use the same rules. So he'll ask you, "So what does this look like? What does it have a frill or does it have stripes? What kind of a color is it?" And then I do the pattern matching the same way as you do, but I cannot see it. Is that true? So they told me how they mix and match
So,
patterns.
could they see before? Probably that would
Kailash could
no.
see before, but Sonali was born
Okay.
blind. Sonali
Uh-huh.
was born blind, and actually she does amazing things. She feels the texture of
Yeah,
everything.
textures generally get more importance
Yeah. So
when you're
one of the
choosing.
things they did was I was trying to buy something for my wife, and they said, "Sir, don't buy this one." And then I was like, "Why should I not buy? It looks so beautiful." And then he said, "Look," Sonali said, "Please don't buy this for your wife." And then I said, he said, and she said, "If you want a second opinion, Kailash can tell you why." So Kailash touched it on. I said, "Oh no, no, just don't buy this." And I said, "Like
Uh-huh.
why?" I said, "Iska color nikal jayega. It'll lose its color." I said, "How would you know that it's going to lose color?" They said, "The dye." They said they touched it and they said this particular cloth, the color has not seeped in. And they said based on the seams and this and that, they said why it's poor quality. So the texture, they were able to tell that somehow the seams were not done well, the stitching was not done well. It was like the way
Right.
it was threaded together, the overall quality, the symmetry of it, and they even said that most likely this particular cloth, this particular design would lose color because they haven't done this kind of processing. I was shocked the first time. I just could not believe it. You know what I'm talking about, right?
Yes.
They
Yeah.
knew much more, and they could tell the quality of the fabric and the texture and the quality of the stitching and the overall symmetry of what they were going to wear, and whether it fits properly or not, and is it designed well or not, much more than a doorless person, a person with eye would do. Because of course I'm not a trained person in in textiles or in fashion design. They knew a lot more than I did. Have you had similar experiences, Dr. Divya?
No, not really. I'm not very good at textile detections. So, of course, like you said, I mainly go on the textures and the feel of it, or the design on it, or if you would have it would have an embroidery or buttons or things like that.
Yeah,
Um,
yeah.
but yeah, mm, I'm not that clever. Like I wouldn't know if it would lose color or things like that. I think
That
I would have to
really,
have
yeah,
more
that freaked
experience.
me out. They're like, this particular cloth
Yeah.
is likely to lose color. I'm like, and how do you
Ah,
know
that's too
that?
much.
So yeah, yeah. And I mean, this is where, I mean, it's beyond compensation. I mean, compensatory behavior is there, but they have kind of come up with their own rules of thumb, or like kind of,
Right.
they try to understand how designers think, or, when there's an inexpensive cloth and if it's not well tailored, chances are higher that those are the kind of side effects of it, if you will.
Right.
And there were many, many such experiences. I mean, I can go on and on. They would know when it was going to start raining, for example, much more than the Dolus people would. The people with my blind students would be able to predict, oh, I think it's going to start raining. And I was like, how do you know? I was like, I felt a few droplets. Their
Yeah, yeah, and it's
sensitivity,
actually that kind of moisture in the air when you breathe that you
yes,
wouldn't otherwise,
yes, yes.
because the air kind of gets so much laden with moisture that you can actually feel it when you're breathing.
Yeah, so
So,
animals can feel that, and people with visual impairment can feel that much more because they're paying attention, which we are not. The guys with eyesight seldom pay attention to, oh, now the air has gotten heavier and it's more moist. So even without a droplet, they could feel the basically vapor pressure, you know. They could feel that the water is getting. Do you feel that too?
yes, especially the moisture, when air really kind of gets laden with moisture, it's much quite probable that it would rain. Like, so,
Yeah, yeah, they were such good predictors of those kinds of things. I learned a lot, and it's changed my life. And I'm not saying it it's no exaggeration to say that spending more than a month with people with visual impairment gave me the understanding of how I could enhance other sensations using sensory
And
deprivation. Yeah.
I think you have been so sensitive to all that because there are many people who are with visually impaired people, but very few of them develop this kind of sensitivity or that kind of a curiosity to build their insights into how visually impaired people sense some things, or how they um, like you said, very subtle things, very minute things, but you were really curious to know how they actually do that. So I should say you're a very like, you love to learn a lot from everyone, per se.
Well, that is one thing I learned from my parents. They said that when I went to the hostel, I was very scared of ragging when I went to IIT. And one of the things my dad, who used to be a postman, said, "Look, Bala, I couldn't teach you everything in life, but when you go to the hostel, there'll be like, how many students will be in the hostel?" I said 250. They said even if you can learn one little thing from each person in the hostel, imagine you could learn like 250 things. And of course, I didn't go to that extent, but I did make it a point to learn a few things here and there. And that's the reason I'm even talking to you. So I have a question for you. We are in the midst of this crazy pandemic. There is a lot of concern, there's a lot of uncertainty. Many people are facing uncertainty so much for the first time in their life, whether it's the risk to their loved ones' lives or their own, or the loss of, you know, means of livelihood and so on. Do you have any suggestions on how people can cope with this kind of anxiety, with this kind of real concerns? They are not fake, but we
Right.
tend to catastrophize. Most people
Yeah.
tend to catastrophize when they're not familiar. But like we know, if we are able to keep calm, then there's much more hope. So, what would you suggest to people about how they can deal with what's happening around?
So, the thing you were talking about just now about learning at least one thing from everyone, that helps us to look at the positivity in each other and even positivity in situations. So, um, it really gets hard sometimes, when we lose our loved ones and we lose a job and things like that. And these are really tough times we have to come out of. But I had heard somewhere that in, like, whenever you fall, defeat is not determined by, because you have fallen, but defeat is declared when you fail to get up. So we humans are we are made to hope, and we are made to hope for better things in life. And so I feel this thing has to be constantly worked upon, because it's not easy to go through these catastrophes, and every person has a different set of problems. So it's it's very difficult for the other person to be in that person's place. But I'm sure, the many of those insights that you also gave, like yoga and meditation, all these things help us a lot, along with physical exercise, physical health. And I feel a good diet and a good sleep, because what happens is, like, I was just talking to a friend of mine a couple of days ago, and she said, "Oh, nowadays I sleep so late and I wake up so late. My sleep cycle has changed." So that's what we were talking about, how sleep helps us to build our immunity and to build our emotional and mental strength. So, and of course, it also helps us to heal physically, to be physically stronger. So I feel it's very important to sleep well, to eat healthy food, and of course, it's okay to have some fast food sometimes, but yes, most of the times to eat healthy, to sleep healthy, to have healthy habits like exercising, meditating, and of course to develop something that would give you a good mindfulness. Like, many of us have an art. Like you said, when you start learning a language, you just get so focused and you just pay your full attention there, and then there's no going here and there. So
Yeah.
I feel when our mind starts wandering, or when we feel that, oh, I'm just going out of control, I think there has to be something to fall back on that would give you that tranquility and that would help you to focus. So it can be music, it can be painting, dancing, any form of art or any hobby that all of us can perceive. Because nowadays, many people are working from home, and many of my patients who come to me tell me that, oh, there's no work-life balance if we work from home, because that that space is actually obliterated. You don't have space for your family. It's all about work and work and work, because you're expected to work all the time because you're available all the time. So that is something, it's very difficult to set, but I think it's very important for employers as well as employees to understand that work-life balance, and it's important to set those boundaries as to when people should give time to their families and when they should kind of get immersed and focused in their work. So I think that would take care of a lot of emotional trials and tribulations that happen at both work front and home fronts. So that kind of balance, I think, also has to be there. And talking to people who are close to us is also very important. Talking about, what about our feelings, expressing ourselves. It's not really easy many times, but even if we have somebody understanding who would just understand that, oh, this person is sad, and just give a patient listening, or just a patient hearing, that's really great to calm the mind down. That's what I feel.
Yeah, you said so many amazing things. And one of the things I'm learning now as I interview, interviewed more than 120 people so far in the last 3 months. It taught me finally what I was missing in my life, which is listening. So, yeah, I'm sorry that I interrupted you a few times, but I've become a much better listener. When I'm talking to people now in real life, outside of the interviews, I assume that I'm now interviewing them, and I've become a much better listener for the first time in my life. So I'm kind of patting myself on the back that it is possible to change habits. It is
Oh, you're
possible.
an amazing listener. You are, for
Well,
sure.
not in day-to-day life. I get too excited. It's like I have to use that chigile phrase like "Gandhi Musri Gilwari," it's like all the time just jumping around like crazy. But on a positive note, yeah, my curiosity is so much that in fact I was going to say Yasu, which is the one Greek word I know.
Yes.
Yes, Yasu,
Yasu.
and of course
Yasu
the
is like hi.
hi, yeah,
Yes.
exactly, and there are very few Greek words I know. I have Greek friends, but I never picked up the language. I know names like
Oh,
Stelianos, Diamantidis, and Aliko, Ko. I know their names. Kostanos and
and
Kostanos.
Greek is amazing because, and I somehow felt very drawn to Greek because I am a medical student.
Yeah,
And
yeah,
now that I learn Greek, I feel, oh, it's so easy for people who are from Greece to learn medicine because so many words are picked up
yes.
from Greek.
Alpha, beta,
So
gamma, delta, right? All the way
yeah,
to omega and chi
yes,
and
and
psi.
micro and megali, and so if it's a cardiomegaly, like the heart is enlarged, it's like
Oh,
cardia and megali of Greek.
that's true.
So
That's true.
and that was one of the reasons I was drawn to Greek, and I really think that language is very musical because you have accents, you have the accent marks that you also have in Spanish, but in Greek you have it almost in every word. So you have to know like, there's a tone of pronouncing every word, and you cannot
Yeah.
pronounce it otherwise. So that has really fascinated me, because I'm into music, and these intonations are really amazing to learn and to pick up.
And if you like intonations and like what do you call the tones, then of course languages of Asia, particularly Chinese, Mandarin, Cantonese. Mandarin
Yes.
has like three tones and then there's the silent tone, four. And Cantonese has like seven to nine. I still cannot get my arms around Cantonese, but like
Oh.
ni, 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 ni. So it's like four tones. It's just
Oh,
amazing
ways
how
of
much.
pronouncing a single word.
Yeah, yeah, and I don't even know how they express emotions because every sound has a meaning. Every
Yes, and
tone has a different meaning.
yes, and even in Greek, so I was really amazed. Like, it's like the same word with the same combination of alphabets, and
Hmm.
depending on where the accent is put, the meaning of the word changes, and of course, the pronunciation changes.
Yeah,
So yeah,
well
like
said.
you said,
Yeah,
when
and
we
that
to
doesn't
that
happen in
language,
many other languages. Only the
yeah,
emotion changes or the emphasis changes.
yes,
But in Chinese, it could completely change what you're saying. The word
same.
meaning is totally, and you're saying Greek is similar. Greek is similar to that. Wow.
Yes.
So much to learn, and I know we can go on and on. I'm so grateful that we had this long conversation for the first time in my life with you, Dr. Divya. And
Thank
it's
you.
such a
And I
joy.
would just like to, oh, sorry to interrupt you. I
Please go
think I'm
ahead.
a very bad listener.
No, no, no,
Uh,
you're a great listener. I wanted to hear you out. As I said, if you have a regular conversation, I'm afraid, and my wife reminds me again and again not to be a patriarch or, don't start mansplaining. And there are good reasons why, as you know, most of us grew up in a patriarchy. So men are often, it's not uncommon for men to dominate a conversation. So I have
no,
learned
you have
to,
not done that. You have given me ample opportunities to
this time I was
go on
listening
and
to
on.
you. This was I was listening to you. But, and I'm practicing. Even at the age of 56, I'm still learning to listen. So I even taught a class on the art of listening, but I'm not a good listener. So I'm practicing.
I'm sure you are. So
It's a
I just
practice.
wanted to talk a little bit about my like physiotherapy practice now during
Please, please.
COVID-19.
Yeah.
Um, so the lockdown in India started on 22nd of March, and then we had to shut down our clinics because nobody knew what course the disease would take and how things would go on. And but then in May, like of course, my father, I should say, was a great source of inspiration for me, and my mom has also, of course, um, it's said that your mother is your first guru, but my father is also a great source of inspiration for me, and especially during this time, he decided that he would be starting his clinic. So I thought, oh, if he's starting, I should, of course, why not? So, and in physiotherapy, what happens is a lot of things, especially for the visually impaired, are based on touch. So many of my colleagues started telling me that it's better you consult your patients, you do telehealth, and many of these physiotherapy in COVID courses. I did a course from Physio Plus, that is a UK-based organization, and they have many wonderful physiotherapy courses. So even they, of course, they had a lot of information on the role of physiotherapy in COVID-19. And they also recommended a lot of telemedicine that was very important, especially for patients who were suffering from COVID. But when you would start your clinic, you would never know who's actually COVID positive because many patients wouldn't even show any symptoms. So um, it was very daunting for me initially to think, how I would touch patients with gloves on, or how I would talk to them with a mask and a cap and shoes and everything and the gown. um, but then, and initially, of course, I was very anxious, very apprehensive about how I would go about doing it. But then I just realized that human beings are one of the most beautiful creations of the Almighty. Of course, Almighty, he's like a master creator, and he has wonderful creations that scientists are still like trying to establish nomenclatures. And I love to learn a lot about nature too. So when I um, when I listen about different animals on YouTube, and I feel, oh my God, what creations! But I think human beings are one of the best creations because they can change a lot, and there's always a room for improvement and a lot of room for changing if the person wants to. So I decided that I should try with my gloves on, because there are many things to feel when you feel somebody's muscles and bones and their tissues. There are many things you would feel with your bare hands and not just with the gloves. But then I really got used to it, and now I should say I'm very much accustomed to it. And another thing that was really daunting me was there's something called as facial paralysis. I hope I'm not boring you. Am I?
Oh no, this is very, very much of interest to me. As you know, I'm very, by the way, I did study a little bit the science of touch with Dr. Dacker Keltner and the UC
Mhm.
Berkeley. They study the role of touch in emotions as well as connection and how it helps in what you call emotional wellness. So I'm very interested in what you're saying. Please continue.
Right. Yeah. So there's something called as facial palsy, or in medical terms, we call it Bell's palsy. And that's like a viral infection, just like herpes. So when the facial nerve gets affected, the the facial muscles become very weak. And we have to do something called as stimulation to kind of re-educate those muscles to contract again. And so, and faith is a very crucial area when you're treating it, especially during COVID times. So I was wondering how I would do it with my gloves on, because faith is a very delicate area, and I just can't afford to have impaired touch, because I don't want, I never have never done that, but I was just thinking of the worst things. I don't want to poke my fingers into my patient's eyes or something. So I was really apprehensive, but um, again, I just thought of never giving up, and kind of changing myself to the best of my ability, to kind of molding myself to the best of my ability to whatever this situation throws me into. So I did it, and yeah, I did well, I should say. So I think it's all about challenging ourselves than um, looking at others and comparing ourselves with them. I think it's all about competing with ourselves than competing with anybody else to make ourselves competent.
Wow, wow. And what you're saying makes so much sense to me, especially the role of facial expression. There are these universal emotions that we convey. And I've heard that even Botox, for example, the use of all these technologies sometimes impairs emotion too. When people, senior people want their facial, they want to look younger.
Right.
Botox is becoming more common, but it has a
Yeah.
side effect. And I'm sure what you were talking about, the what is it, facial palsy, maybe it's kind of like induced facial palsy in that case, isn't it?
Um, yeah, so it kind of affects the way your muscles would contract after the effect of the Botox goes away. But facial palsy is really temporary. So it's like the virus that affects your face. So once the viral infection subsides, the face should receive stimulation and good exercises to kind of come back to its own shape. So facial palsy patients generally recover completely. And physiotherapy has a very vital role in that. And So patients can come back to their normalcy, but yes, when they are going through that facial palsy, like you said, emotions are considerably affected, and even the articulation of speech, because the lips don't quite come together, or the patient is not able to smile properly. So the patients even get affected emotionally, because the first thing that anybody sees is your face, and when they see you smile like like a crooked smile, everyone would ask, "Oh, what happened?" And all.
Yeah,
So patients
yeah.
really get affected emotionally too, more than like, of course, the physical affection is always there. So we have to counsel them a lot about their emotional state, and how to not care about what people would say or scare them, or things like that. So that aspect also becomes very important. But of course, it comes back to normal. So yeah, but the thing that you were talking about, like the Botox, yes, it does have its set of side effects, because it actually affects the muscles. So it kind of affects the way muscles contract. And our facial expressions are all about the tone in the muscle, and Botox actually um, affects the tone of any muscle.
Yeah, and I mean, what you just said actually makes sense because we look for feedback from each other. So if I have somebody smiling, naturally we will micro mimic it, and therefore we also start to smile whether we like it or not. There's that micro mimicry that automatically happens. The mirror neuron system kicks in. I'm using these terms a little loosely, but you know what I'm talking about. But
Yes.
when somebody's face is distorted, um, either because of any temporary illness or say other conditions like autism, then other people have difficulty because their mirror neuron system will behave in weird ways. They are not able to understand the the signals or the interpretation of the emotions, and I can see that that's probably the reason why people cannot relate to others who are in different physical or emotional states.
Yes, right. Like it needs a lot of um, work, I think, to kind of relate to anyone who's a little different than what we are or what somebody else is.
Yeah, well, we've talked about so many things, and no, none of that to me was a distraction or a side topic because for me, as I said, I love everything, and the more I learn about little details, that it kind of helps me to connect and create a tapestry of understanding. There was a time when I was a typical techno mathematics, physics, engineering geek, and that was such a reductionist approach. Then I learned, medicine, particularly pharmaceuticals and toxicology and pharmacology from my wife. She's a pharmaceutical scientist, and then that's how I got into the biotechnology side of things. And then I got, because of my illness, when I had this plantar fasciitis plus the tendonitis, I was forced to understand the mind-body relationship, and that's how I got into the neuroscience of happiness and compassion. So again, none of this is a distraction for me. I just want you to know that.
Wow, you're just amazing. And it's so amazing that you just kind of learn everything, wherever you
Well,
go and whatever you do. And
as
even
my
from the painful experiences, you always have something to learn from them.
we do learn
So,
more
yeah.
from our pain, isn't it? We learn much more from our pain than from pleasurable
Mm,
experiences. We just wallow in it. But
yeah.
the pain teaches us things that probably pleasure cannot. I don't know. That's what
And
my
it's
feeling.
so nice that, we find people who give us so much strength sometimes. So I
Yeah.
was just telling you about how I took up physiotherapy. And so when I wanted to go in for my graduation, that concept was not there in India back then of mainstreaming people with visual impairment in a regular physiotherapy college. So I was a little, I won't say apprehensive, but yeah, I was thinking about how everything would go and things like that. And so I was just talking to our spiritual head, our Guruji, Param Pujya Sadyojat Shankarashram Swamiji, about should I do this? Because, I literally felt like I'm standing in front of an ocean and I want to dive in it, and what should I do? And he said, yes, of course, you should do it, and you would be a source of strength to others. And those words of his gave me lots and lots of strength to just dive into it and to just face whatever it would bring. And I feel nature too helps me a lot to develop that mindfulness. Like there's something called as Ashtamurti Upasana that our Swamiji talks about. That also helps a lot to focus the mind and um, to develop, to look inwards. I feel like you were also talking about Vipassana.
Yeah,
So the
yeah,
things that our body is made up of, the elements
yeah.
of me.
And I mean, what you're talking about, one of my favorite um, ways in which I deepened my understanding of mindfulness and awareness was the Dhyana Praveshika, that the first video or first audio video that our Swamiji produced. Dhyana Praveshika is about how do you get into dhyana or focused attention, if you will, which is the beginning of any meditative practice. How do you bring focused attention to and mindfulness to whatever we do? And he starts with bija mantras and understanding of the different energy centers in the body. And it's just amazing. I really enjoyed that. I was very lucky because my mother lived in that village, Chitrapura. So I have met him many times from the early 2000s, from 2003 onwards. And what a boon to be able to do that. And the funniest part of being in Chitrapur when I was there for a few months was everybody says Jai Shankar, Jai Shankar, and I'm like, oh, they're calling me because our Swamiji's name is Shankarashrama or Sadyojat Shankarashrama. So the Jai Shankar thing has become like a way of saying hello, and I'm like, oh, they all seem
Yes.
to know me.
And yeah, and I think it's also about our deity, the deity in the temple. It's
Yes.
Lord Bhavani Shankar.
Yeah.
So
Yeah.
yeah,
Yeah.
it's Lord Shankar with the Bhavani, with the goddess on his lap.
Yeah.
And I think that's also one of the reasons everybody says Jai Shankar.
Yeah. I was
But
like,
yes, yeah, that's yeah.
the narcissistic
That's
side
also
of me
been
will
so.
take it.
I'm sure you must be wondering, oh, where do I look? Oh, so many people. Oh, they're all calling.
The first time it was amusing, and
I'm in demand.
yeah, yeah, like for the first time in my life, I felt validated everywhere. So, well, again, Divya, what a wonderful way of having a first long conversation and learning from you about so many little things. And yeah,
It was my
my
pleasure, and I got to learn so much from you.
yeah, and we are all here to support each other, as I said at the beginning of this conversation. So, anybody listening to us still, please feel free to contact us. I will definitely provide my links and Dr. Divya's contact information as well, your website, and any other information you can give for people who may be particularly interested in our work, both in physiotherapy or special needs, people with special needs, and especially visual impairment, or any other things that, any particular things that you would like to share, Dr. Divya. I will include that with the YouTube video and on any other medium such as Instagram or Facebook. um, to me, it's a joy to be able to listen and learn. And as I said, I'm new to listening to people in great depth. So that's the best thing I have learned from this process. So anybody out there who wants to talk to me, at least drop me a line and we'll find a way to do that. Do you have anything last words to say, Dr. Divya?
No, just thank you so much for inviting me. And it was a pleasure talking to you. And wow, we spoke about so many things. It was really
Yeah,
wonderful talking to
yeah,
you.
and
Thank you so
we all have so much more to learn, and we have so much more to learn by just being with each other, even during, especially during these times when we are so much more isolated and distant from each other.
Yes.
Thank you again, and please stay in touch.
Thank you. Thank you.